The FXB Center was established over 30 years ago, and it was established with the vision that health and human rights are intersecting, and both are critical to the attainment of health for all people. It was the vision of our founder and benefactor, Albina Dubois-Rousselet, who made the gift that established FXB and continues to support it to this day.
The FXB Center is distinctive, I think, for various reasons. First of all, it brings together a relatively small group of very talented, original thinkers who do impactful social work and who have a real commitment to social justice. The second thing I'd say that's important about the FXB Center is that the topics we work on are both mainstream and marginal. They're mainstream because they are to do with very important social issues of our time. They are not mainstream in the sense that they are often neglected. These are not topics that are easy to fund. These are not topics that are often taught at university, and so our research is distinctive for that reason.
When FXB was founded, it had a special focus on children, because when rights are violated, children suffer the most.
There are an enormous number of children who are both experiencing homelessness in this country and in the state, and 1/4 of children in the United States have at least one parent who is an immigrant. So the program on immigrants and unhoused communities really focuses to highlight the need for greater public health involvement and a human rights-based lens on the health of both populations.
We planted the seeds of the Roma program for health and human rights back in 2011, 2012, when Professor Jacqueline Baba, Arlen Fuller, I, and other colleagues came together to imagine and design a participatory action research with Roma adolescents in Europe. We are looking at discrimination in schools. We are looking at school segregation, at waste and toxic environments in Kosovo that are affecting the health of Roma children and their families.
The distress migration program at the Harvard FXB Center focuses on people who are forced to leave their home countries to find a better life. Our program is one of very few, if not the only one, that focuses on distress migration, a concept that is coined by Professor Baba.
I have worked on two main areas where my training as a human rights lawyer intersects with my interest in social justice and human rights. I think the reason that we work on failures of protection and the gaps that exist in our society in terms of protecting vulnerable communities is that we feel documenting these failures and highlighting the ways in which vulnerable, innocent communities are really let down by their state structures is very important. And we believe that good evidence can actually change practice. And I think we have examples of that where work in the child protection field has led to changes in the way local government or even federal government interact with some of the populations in their care.
The Palestine Program for Health and Human Rights is the only academic program focused on Palestinian health in the United States. We engage in a collaborative, justice, human rights-based approach in the study of Palestinian health in the occupied territories, but also Palestinian refugees and Palestinian citizens of Israel. Palestine is a very young population. It's estimated that children make up about 43% of the Palestinian population. And so broadly speaking, every health issue, every health challenge, every health condition we address in our program significantly affects the lives of children.
The research that I do personally has long focused on the ways in which racial and ethnic classification define health, and to the notion of what we call structural racism. There has never been a year since, well, even before the founding of the United States, that people of African descent haven't had shorter and less healthy lives. And that gap continues to this day.
My work really focuses on sort of the power imbalance and marginalization that Black women face globally and how that impacts access to resources, overexposure to environmental pollutants, and then also health behaviors. A large part of sort of what I was thinking about in my work was not only the research around structural racism, but also how to disseminate that to larger audiences. And most of that was due to the flexibility that I had to sort of like navigate TikTok and navigate Instagram and other platforms as a postdoc without having the obligation of working on other people's research.
So the alumni network that we've created, we use an online platform, and we link people who've gone through the G. Barry Landry Child Protection Professional Training as well as the Child Protection Certificate Program. As folks complete these programs, we invite them to join this alumni network.
One of the things that we're really committed to is to continue to build the pipeline of scholars who see human rights as important to health. And this area of training is under threat at the moment, and I'm very proud that we at FXB have been able to train graduate students, postdoc students, and I'm sure that they will become the leaders of the future.
Thanks for watching, but now an important disclaimer. The content of this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Viewers should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.